Hi, it's Barry Joyce from Smart and welcome to this video. Now in this video I'm going to be going through the categories, and as you can see I've got the noise and vibration category highlighted there. For those people that's been following this series of videos, whether it's the mock tests or the categories, there are approximately 610 questions ish on your CSCS test. You are getting 50 of them, sorry. Now although out of those 50 questions, they are all broken down into these categories in front of you, and you're going to get a certain amount of questions per category. And an example for this one, as you can see, the noise and vibration, down here there are 29 questions in here. In this category, you are going to get 3 questions on noise and vibration. So I'm going to hopefully get you the right answers. I'm not guaranteed to do so. But hopefully as well is to give you some tips and hints along the way. So what we're going to do is I'm going to click next, and we're going to be going to the first question. And like all of the mock tests and all the other categories, I always read the questions out. I strongly recommend you do the same because it will help you.
What are the signs and symptoms of noise-related hearing damage? Nausea and a skin rash around your ears. There are no signs or symptoms associated with hearing damage. Difficulty following a conversation, especially against background noise. Ear infections and regular headaches.
Okay, for this one then, it's actually difficulty following a conversation, right, especially with background noise. Early signs of hearing loss is temporary and then permanent. Again, if it becomes permanent hearing loss, it is irrecurable.
Can the damage by exposure to noise over a long period of time be reversed? No, unless medication is used. Yes, if you have an operation. No, the damage is permanent. Yes, if you change jobs.
I think I've just answered that one. So, yeah, the damage is permanent.
If you need to wear disposable foam earplugs, how should you insert them so they protect your hearing from damage? Do not roll or fold them and insert them halfway into your ear canal. Roll them up and insert them while pulling the top of your ear up to open up the ear canal. Soak them in water, squeeze them out, and then insert them into your ear canal. Fold them in half, pull on your earlobe, and wedge them halfway into your ear.
Okay, so it's roll them in, insert, pulling the top part of your ear, all inserting them into the ear canal. Some belter questions there.
What are 3 early signs of hand-arm vibration syndrome, HAVS? Rash on the fingers. Temporary loss of feeling in the fingers. Fingertips turn white. Blisters on the fingers. Tingling or a pins and needles sensation in the fingers.
So hand-arm vibration syndrome, or HAVS, is permanent damage to the fingertips, and it damages all the blood vessels within the fingertips. It is irrecurable, you can't cure it. So the early signs of that is loss of sensation. Your fingertips actually turn white. It's actually known as white finger, and you're going to have tingling or pins and needles in the finger.
What should you do if you need to wear ear defenders but an ear pad is missing from one of the shells? Take an ear pad from another set of ear defenders. Leave them off and work without any hearing protection. Do not work in noisy areas until they are replaced. Put them on and work with them as they are.
Yeah, key word in there, look, do not work. So anything that says don't work, stop work, report, always going to be the answer.
Which of the following is the main cause of hand-arm vibration? Avoiding using equipment that vibrates. Regular use of handheld tools and equipment that vibrate. Using a low vibration equipment for short periods of time. Taking part in training using vibrating equipment.
So as you know, the hand-arm vibration syndrome is that permanent damage to the fingertips, using power tools that vibrate. So regular use of power tools, and we're talking things like hammer drills, pneumatic drills.
How can you help reduce the risk of hand-arm vibration when using a vibrating tool? Use more force on the tool. Do not grip the tool too tightly. Hold the tool more tightly. Hold the tool at arm's length.
Okay, so for this one, you're going to not grip the tool too tightly.
What health problem can be caused by using handheld vibrating tools? An itchy skin irritation like dermatitis affecting your hands. Damage to the blood vessels in your fingers and hands. Blisters on your fingers and hands. Skin cancer on your hands and arms.
As previously mentioned then, it's damage to the blood vessels in your fingers and your hands. Permanent damage.
What risk does this worker face by using this tool on a regular basis? Back injury caused by using heavy equipment. Dermatitis from repetitive use. Weil's disease caused by the dust. Hand-arm vibration from prolonged use.
Okay, so these type of questions, just have a look first and foremost. He seems to be having all his PPE on, so he's got his gloves. So for me, the risk for this would be hand-arm vibration for prolonged use of a hammer drill.
What do the initials HAVS stand for? Hand and ventilation system. Heavy arm vibration system. Hand-arm vibration syndrome. Heat and ventilation syndrome.
Yeah, it's hand-arm vibration syndrome, as we mentioned before.
What should you do if someone near you is using noisy equipment and you have no hearing protection? Ask them to stop what they are doing, as it is disrupting other workers on site. Carry on with your work, as you are not the person using the noisy equipment. Speak to the other person's supervisor to stop them making the noise. Leave the area until you have the correct personal protective equipment, PPE.
Yeah, straightforward. You're going to leave until you've got the correct equipment.
What should you do if you have to raise your voice to make yourself heard on site? Stop work and raise it with your supervisor. Carry on working, as it is not a problem. Pack up and leave the site. Tell the person making the noise to stop work.
Okay, keyword and again, stop work, raise it with your supervisor, always going to be the answers. Now, in some of the categories, you may say stop work and raise with your supervisor, and also in that questions is, the answer, would be stop work and raise it with the contractor supervisor. Always your supervisor.
You are less likely to suffer from hand-arm vibration syndrome, HAVS, if you feel which one of the following? Warm and dry. Cold but dry. Wet but warm. Cold and wet.
Yeah, it's going to be warm and dry, isn't it?
What are 2 recommended ways to protect your hearing? Ear defenders over your ears. Soft cloth pads over your ears. Earplugs in your ears. Cotton wool pads over your ears. Rolled tissue paper in your ears.
Yeah, okay, some great answers there. Of course, ear defenders, I'm going to drag that across, and earplugs. Just have a look at what's left. It just doesn't make sense.
You have been using a vibrating tool and the ends of your fingers are starting to tingle. What does this mean? You can carry on using the tool, but you must hold it more tightly. You can carry on using the tool, but you must loosen your grip. You must not use this tool or any other vibrating tool ever again. You need to report your symptoms before they cause a problem.
Okay, anything that says report symptoms, stop work, report symptoms, always the answer.
Using a grinder whilst wearing this personal protective equipment, PPE, could result in which of the following? Lung disease, Weil's disease, eye injuries, hearing damage.
Okay, again, now we just need to look at this image and see what PPE they are not wearing. If you're struggling to do it, the way to look at it is lung disease. So what's going to cause that? It's respiratory. He's wearing that. Weil's disease, that is leptospirosis, that's your rat urine. Eye injury, he's wearing goggles. Hearing damage, yeah, he's not wearing goggles. Hearing protection, sorry.
How can excessive noise levels affect your hearing? Give 2 answers. Hearing improvement, ear infections, temporary hearing loss, permanent hearing loss, dizziness and nausea.
Okay, so excessive noise levels will affect your hearing because you'll get temporary hearing loss, and then potentially it could become permanent, known as tinnitus.
Which one of these tools is the most likely to cause hand-arm vibration syndrome, HAVS, HAVS? Hammer drill, hand saw, battery-powered screwdriver, hammer and chisel.
Okay, so which one is most likely? So looking at it there, of course, it's going to be the hammer drill.
Why is overexposure to vibratory tools and equipment a serious issue? The long-term effects of vibration are not known. There are no early warning signs of damage caused by vibration. Vibration can cause disabling health conditions that cannot be cured. There is no way that exposure to vibration can be prevented.
Okay, so mentioned earlier on, HAVS is permanent damage to the fingertips, and it's a disabling health condition and it cannot be cured.
What is hand-arm vibration syndrome? HAVS. A mild skin rash that will go away eventually. A serious skin condition affecting the arms that will not clear up. A range of conditions that can lead to permanent damage. An injury caused by severe frostbite to the hands.
Yeah, of course, with it being permanent damage, so it's a range of conditions.
What does wearing hearing protection do? Helps you to hear better. Stops you hearing all noise in the workplace. Reduces damaging noise to an acceptable level. Repairs your hearing if it is damaged.
Yeah, nice straightforward one. It's going to reduce the noise to acceptable levels.
Your doctor tells you that you have hand-arm vibration syndrome, HAVS, possibly caused through work. What should you do? Tell no one, as HAVS is not reportable. Tell no one, as it's not contagious. Only inform your friends at work. Inform your supervisor or employer.
Okay, so straightforward, you're going to inform your supervisor or the employer.
How can the effects of hand-arm vibration be reduced if you are using vibrating tools? Hold the tool as tightly as you can and work quickly. Complete the job in one long burst. Only use one hand at a time on the tool. Do not smoke, as it affects blood circulation.
Okay, this might surprise one or two of you with this answer, but it is actually do not smoke, as it can affect the blood circulation.
What should an employee do if they think noise at work may have damaged their hearing? Plug their ears with cotton wool to stop any more damage. Take time off work as they are unwell. Nothing, as the damage has already been done. Ask their employer or doctor to arrange a hearing test.
Yeah, nice straightforward one. You're going to ask to arrange for a hearing test.
Noise levels may be a problem if you have to raise your voice to be heard by someone standing how far away?
Okay, if you come across this question, all you have to do is click what you think it is. So in this case, it is actually 2 meters. make sure you don't click there or there on the line. Just get it right in the middle, because you never know, it just might mark it wrong.
If you have to use a vibrating tool, what would you expect your supervisor to do? Watch you using the tool to assess the level of vibration. Explain safe methods of use and give advice on exposure times. Measure the level of vibration every time you use the tool. Ask you to make up your own safe system of work for use of the tool.
Of course, because it's a safety issue there, you're going to explain safe methods and give advice on exposure time, i.e. how long you're going to use that particular machine for.
Which two potential health issues are more likely when using a hammer drill for long periods of time? Hepatitis, carpal tunnel syndrome, vibration white finger, head injuries, speech impairment.
Okay, what two potential health issues? So, carpal tunnel syndrome is damage to the wrists, and you're going to get vibration white fingers. They are going to affect heads, speech, and hepatitis is a skin disease.
If you hear a ringing sound in your ears after working with noisy equipment, what does this mean? The noise level was high but acceptable. Your hearing has been temporarily damaged. Your hearing protection was working properly. You have also been subjected to vibration.
Okay, so in this case, it does mean that your hearing has been temporarily damaged.
What is the main risk to this worker wearing only these items of personal protective equipment, PPE? Breathing in harmful dust, dermatitis to skin, damage to hearing, eye injuries.
I'm sure we've just had this similar question, if not the same question really, but it's come up, I do believe. So again, just have a look at the image here. What's he not wearing? Breathing in harmful dust, he's got a dust mask. Dermatitis to the skin, he's wearing gloves. Damage to the hearing. Now again, I've noticed he's not wearing hearing protection. Eye injuries, wearing goggles, so I'm going to go with damage to hearing. Okay, so that is the 29 questions there. So out of those 29 questions that we've just looked at, you're going to be getting 3 on your actual CSCS test. So again, just read the questions, get them read out here. There's nothing wrong with that. You're in your own little zone. Get the headphones for your test. I hope you're getting a few little pointers out during those questions, and I look forward to seeing you in the next video.